नमस्कार दोस्तों, a very chilly good evening, सलाम सत श्री अकाल एंड आज हम फिर हाजिर हैं डॉक्टर सीमा पांडे टॉक शो द नॉलेज शॉट्स के साथ। फ्रेंड्स, for last 10 or 12 days we have been doing this program, and let me tell you, we are getting such a beautiful reviews about it, the kind of content we are discussing with our experts that is beyond the imagination of people, that they all wanted to know about all these things too. So in the question which we are discussing today,
मैम का हैंग हुआ है क्या अनुराधा मैम? कि
Okay,
मुझे नहीं
okay.
दिख रहा?
So, good evening, everyone. So, we are continuing our knowledge shots today, and I think Dr. Seema Pandey's internet has some issue, so she'll be back with us. And hereby, I welcome Dr. Tanushi Sri Pandey. She is an IVF specialist, like all of us, but a very good person, very warm hearted person, and additionally, she has one more degree. So, Tanushri, please tell us what is that additional degree and then you introduce yourself.
Thank you so much, ma'am, for your kind words. I'm so humbled, and thank you for such a warm introduction. I also won the title of Glad Rags Mrs. India in 2015. So basically, with padhai, with medicine, with everything, I took a sabbatical of 2 years. I did modeling. I represented India internationally, and then got back to gynecology and pursued my passion in IVF and DAC.
thank
So,
you,
thank
Tanu.
you.
Actually
Yeah,
my connection went
yeah,
sometime
No
went
Dr.
wrong
problem,
Seema,
with
ma'am.
my connectivity.
she has just introduced, she's introducing herself. So she has been Glad Rags Mrs. India. And so I want to tell my viewers that doctors are not only hardworking, doctors are not only intelligent, doctors are not only passionate about what they do, but doctors also are glamorous. I mean, not all of them, some of them. So they make their mark, they can make their mark anywhere. So she has been into modeling, she has won the title. So we are not boring people. So, Dr. Seema, please take over.
Telling that as a treating physician, we have to take care of this aspect of the life too, because ultimately, this couple who is going to have a child has to have that certain bond, which is not only needed for the child, for their future lives too. And we have to remember that whatever we are doing through is this fertility journey, this is for our own happiness. As a couple, I always tell my patient that you come first, and child is the result of that love, bond, and support. On this note, today we are going to talk to Tanushri Pandey, who is a big influencer creator. She talks about lot and loads of issues, and I was really impressed the way she takes all these problems. So Tanu, first of all, I would like to know, as an infertility and specialist and reproductive medicine specialist, you come across all these couples who are being treated for infertility. What is your experience? What are they going through, and how are they dealing with
Right.
this problem?
Right. Thank you, ma'am. For at the outset, first, thank you for having me over. It's an absolute privilege to be with such stalwarts from the fraternity. And ma'am, like you rightly said, and this topic is so beautiful that has been selected about the compatibility between two partners. Because what happens is when you sit across a doctor and you start this journey, which is infertility or subfertility or any issue that you are facing to have a child, you somewhere forget yourself. And you are so agonized and stressed about मेरे को बच्चा होएगा नहीं होएगा, that the initial bond which got you into having a baby somewhere starts dying out. We often, ma'am, you'll agree, we see patients coming, fighting. It's so difficult to say whether it's male factor, female factor, both. There are families who are involved, the in-laws will come, the parents will come, and then there's a lot of pressure on the couple per se. And like you very rightly said, that the very stem and the root should be the togetherness, and the very fact that it was their compatibility initially that led to wanting to have a child. And not to forget that in the process of fertility, because we'll be able to guide you medically and solve your problems, but once it's an emotional or a compatibility stress, it becomes a great issue which is never dealt with, which then leads to more stress and further problem and agony.
Yes, Anu, very rightly put.
Right.
And that is the reality of the day. That
Right.
in this whole journey, they forget the very reason why they are together and why are
Right.
they wanting this child. So, as we all are busy practitioners, we look at their ovulation and ovulation. Many a times, as you said, that mother-in-law,
Right.
parents, they all come into this whole thing, and they keep blaming each other. Sometimes female, she is not having any kind of issue, just because her partner is suffering from some issue, she
Right.
cannot disclose it to people, and she is bearing the burden of dealing with her own unhappiness along with all those tanas which she is getting. Like in India, in our society, middle class society, I think it's a tagline or a icebreaker. कैसे हो, शादी हो गई कि नहीं, शादी हुआ तो बच्चा हो गया कि नहीं, पहला हुआ तो दूसरा कब होगा. तो we just start opening up like that, but we don't realize that we are touching a nerve which could be really a sensitive point for few of us who are
Right.
not having that pleasure in life. So as a society, we have to mature, and as a doctor, we are so busy that we are looking at all the medical reasons, but most of the time we forget whether whatever we are telling these people, they are following it or not. Are they really gelled with each other? Are they following everything happily? Most of the time you will agree that once infertility sets in, all the physical relations, they are me being made for having a baby. Those days dates, the movie that has depicted very nicely, and nowadays couples are coming, and especially male, and he'll be telling you that ma'am, it is so much pressure, and that becomes like a performance pressure, and that takes away all the joy, all the happiness which you are going to derive from this relationship which nature has made for you as a couple. So Tanu, what do you think? What, as a treating physician, how can we change it? What can we do for our couples?
Ma'am, I want to share a small anecdote because the patient came in today only. And what happened is this patient was just married for 1 year. They had a lot of pressure from the family members to have a baby. And I saw all the reports and preliminary, did the HSG, everything looked normal. And so I told them, I said, first let's just start with basic medication and help. We'll give it 6 months, young patient, 24-year-old girl. So I said, and mostly you will conceive. So 1 month passed by, second month they came back, and then the husband said, "Ma'am, I need to talk to you in private. I need to say something." So I said, "Okay." I called the nurse, and then he said, "Ma'am, I'm not being able to perform ever since the stress of the child has come. The first 6 months of marriage, everything was fine. I had no problem. Ever since, it feels like somebody's waiting outside just to hear is there a good news or not, and that's why we are keeping relations." So I told him, I said, what, if this is the problem? Again, 1.5 months, we gave him whatever medication we could. It wasn't happening. So I told him, I said, next month, I will help you with an IUI if this continues. This month, don't think of keeping relations in the point of view of having a child. Just, and don't even worry about dates, nothing. You treat it like a vacation. You treat it like you've gone, you all are keeping a partnership and a relationship for pleasure and for togetherness, not to have a baby. And today she came with UPT positive, ma'am, because he said, "Mera sab problem dur ho gaya," because that stress was removed. So I think, ma'am, like you very rightly said, that one part of the society, yes, where we are still struggling is where, it's not always the woman's fault. That if, it's basically it's nobody's fault. It's just a condition. How, supposing appendix का दर्द होता है, तो हम ये थोड़ी बोलते तुम्हारी गलती है. We say कि भाई appendicitis है, उसका तुमको इलाज कराना है. So why is subfertility a गलती कि इसमें दोष है या फिर आदमी में दोष है? And similarly, in especially in Indian society where the patriarchy is still very prominent, men also face a backlash wherein it's somewhere the woman में प्रॉब्लम है, चल जाएगा एक बार, दिल sympathize with her, अच्छा उसमें कुछ कमी है, अभी उसकी ट्रीटमेंट चल रही है. But the man is not allowed to sit in a room full of people and say, no, the problem is in me. So you also understand why these men have such inflated egos, because there is no acceptance even today. There's still, because in the mindset it's like बच्चा नहीं हो रहा, औरत में problem होएगा. आदमी में problem है will become a talk of the town.
Yes. No, you are muted.
Please unmute.
Tanu, you are
You are,
muted.
I think
so
she'll come
as
back.
yeah,
So,
as Dr. Yeah, please Anu continue.
as we were discussing, see, in India, we know when we get married, whether it's a love marriage or an arranged, the girl and boy, they are not the only one who gets married. You marry the family, if all of you agree with me. So
Yes.
family is hand in hand with us, whoever gets married, and family is very important for us also. But at the same time, we also have to understand, as a family, if there's a newlywed couple in our family, one, we should not pressure them. Second, we have to give them privacy. That privacy in middle class is considered something which is not good. कि इनको क्या प्राइवेसी चल रहे हैं, हमारे तो इतने बच्चे हो गए, दैट काइंड ऑफ थिंग. वी हैव हैड, I mean, the in-laws will say, we've had all children, we have been not only with one family, we have been with multiple people and joint families, big families, फिर भी we had children, what's their problem? So over to Tanu, please continue.
I'm so sorry for that glitch, ma'am. But I mean, whatever you are saying is, of course, it's just added so much more to what I was saying. But in short way, that, ma'am, as a society, like you rightly said, that we have to normalize. Number one, normalize the journey of fertility. I think somewhere as a society, like you rightly said, we have started using different words. We do not straight away say infertility, which we earlier used to say. Now we are talking as subfertility, or we are talking it as a journey of fertility. Just like that, as a society, A, we have to normalize this whole journey. B, like you very rightly said, that they have to realize they're complete already. So when they say, "Arey, abhi family complete हो गई है," is a sentence which I get very irritated at, because family कब complete हो रही है वो सबके लिए अलग है. किसी के लिए single woman and a single man is their family. For some people it's a partnership in marriage. For some people it'll be one child. For some people two, three. For some none. So I mean, we as a society have to sort of stop using terms like, "अरे अब तो एक लड़की हो गई, चलो अब लड़का हो जाएगा तो family complete हो जाएगी." You know, it's just an endless saga. So if we all of us can इतना pressure निकाल दें, ma'am, we all will agree that every once everything fails and we've tried all our the highest knowledge that we have in IVF, finally it is कि you're taking too much stress. Go take 2 months, 3 months break. We need the stress levels to come down. And this is where I think today's talk is principally about why are we talking and stressing about compatibility, is because the outcome of it will be stress will be reduced. And half the battle will be won on its own.
Yes, very right. Tanu is having some
So
network
here
issue.
comes the role of counseling. It is very important. The couple who is coming to the doctor, not only the medical management, somewhere counseling is the most important tool which can to some extent help these couples, because most few couples are fighting in front of the doctor. Even they are not compatible enough that they can manage half an hour being in a harmony. So this is what is going to be trend. And lately The family is pressurizing, but they are not aware that what are their personal problems. I had a patient day before yesterday, and even after 7 years of marriage, there was
We lost Arshi now, and Tanu, you can continue. Dr. Tanushri.
Muted.
Why is she having problem?
Yes, Tanu. सो व्हाट इज द मेन, हम यहाँ पे कॉम्पैटिबिलिटी का मतलब क्या समझ रहे हैं, मैं अपने हिंदी भाषी दोस्तों के लिए थोड़ी सी बात कर दूं। हम बात कर रहे हैं कि अगर हमें बच्चा चाहिए, हमें फैमिली चाहिए, तो उसके पहले पति और पत्नी का जो आपसी रिश्ता है, उसके बीच एक सद्भाव, एक तरह का बॉन्ड, लगाव, प्यार जब तक डेवलप नहीं होगा, हम कुछ भी कर लेंगे। हमारे घरों में कहा जाता है, बड़े बुजुर्ग कहते हैं कि एक बच्चा हो जाएगा तो सारी प्रॉब्लम ठीक हो जाएगी। सॉरी एल्डर्स, विद ड्यू रिस्पेक्ट मैं आपसे कहना चाहती हूँ कि सबके लिए पति पत्नी का रिश्ता का मतलब सिर्फ बच्चा पैदा करना नहीं है। स्पेशली आज की जनरेशन उस बच्चे को पैदा करने से पहले एक दूसरे को समझना चाहती है। उनके बीच में जब इतनी अंडरस्टैंडिंग आ जाए कि ये ब्लेम गेम खत्म हो जाए कि कमी किसके में है, और जैसा डॉक्टर तनु ने बोला कि जैसे अपेंडिक्स होता है तो कोई किसी को, यही महिला अगर उसके पेट में दर्द होता है तो पूरा खानदान लेकर के दौड़ता भागता हुआ आता है, 2 मिनट डॉक्टर ना देखे तो वो परेशान हो जाता है। लेकिन जब ये जर्नी फर्टिलिटी की होती है तो एवरी मंथ जब एक औरत को पीरियड आता है, पीरियड के बाद मतलब दिस इज 80% ऑफ द फैमिलीज आई एम टॉकिंग अबाउट whom आई ट्रीट, वो बोलते हैं कि ऐसा लगता है कि कोई मतलब कुछ बहुत बुरा हो गया है घर में, एमसी आ गई है मेरे को मैडम, और वो स्ट्रेस इतना ज्यादा होता है। टुडे आई वाज टॉकिंग टू अ बॉय, ही हैड कम अलोन and he was talking, he didn't want to disclose this to his family, उसकी जबरदस्ती शादी कर दी गई थी। नाउ ही इज अ स्टूडेंट, ही इज ट्राइंग टू प्रिपेयर फॉर फ्यूचर करियर, along with that 2 साल शादी के हो गए हैं, lot of fighting and things happen, he is unemployed, and now they have started pressurizing him for having a baby, and even wife wants that if a baby, बहुत सारी बार ये होता है कि महिला की कहती है कि मैम जाने दो, जो हो रहा है चलने दो, हमारे बीच में बच्चा हो जाएगा, मैं बच्चे में व्यस्त हो जाऊंगी। लाइफ इसके लिए नहीं है। आप गृहस्थ जीवन जो हमारा बनाया गया था, वो बेसिकली बनाया गया था एज अ कपल, आपको इस जर्नी को एंजॉय करने के लिए। तो 1 साल 1.5 साल मैटर नहीं करता है, मैटर करता है आप दोनों का साथ और वो कितने प्यार के साथ गुजर रहा है। और अगर वो चलता रहेगा, मैं ये नहीं कह रही आप दवा मत कीजिए, दुआ मत कीजिए, लेकिन उसके साथ साथ प्लीज उस जर्नी में ऐसा मत खो जाइए कि सब कुछ बच्चे रिलेटेड हो जाए। एज तनु सेड दैट मेल्स, दैट इन्फ्लेटेड ईगो, हम अपने बच्चों को, बेटों को सिखाते हैं कि मर्द को दर्द नहीं होता, मर्द रो नहीं सकता, तो वो सारे टेंशन और प्रॉब्लम को अपने अंदर एब्जॉर्ब किया रहता है, और जब वो आता है किसी भी तरह से निकालने के लिए, तो हम अपना जो वो दर्द है गुस्से के रूप में हमेशा अपने क्लोजेस्ट पर्सन पे निकालते हैं, और वो इस केस में आपका स्पाउस होता है। तो मोस्ट ऑफ द टाइम यू वेरी राइटली सेड कि मेल फैक्टर जहां इनफर्टिलिटी में आ गया, वहां पे इक्वेशन गड़बड़ जाता है, दैट सिंपैथी बिकम एंगर, लॉट ऑफ फ्रस्ट्रेशन, एंड दैट इज बीइंग रिफ्लेक्टेड इन डिफरेंट फॉर्म्स, इन फैक्ट समटाइम्स एज अ फिजिकल अब्यूज। सो ये नहीं करना है। आप दोनों एक गाड़ी के दो पहिए हैं, किसी को कुछ भी हो सकता है, दोनों को मिलके उसको चलाना है। तो हम उसी कंपैटिबिलिटी की बात कर रहे हैं, और आज हम ये बातें कर रहे हैं एज अ डॉक्टर, हम इसमें क्या सुधार आपकी लाइफ में कर सकते हैं। तो मैं जानना चाहूंगी डॉक्टर तनु, वुड यू लाइक टू टेल अस व्हाट आर those things which a couple can do apart from जो भी फैमिली से उसको सपोर्ट मिल रहा है, उसके अलावा एज अ कपल हाउ, what can they do to make this journey easier for each other?
Right. So, ma'am, I think सबसे first message that I would like to give to our audience who is listening कि like we've been reiterating and saying that गलती या दोष ये तो इस जर्नी में वर्ड ही नहीं यूज करना है. So it's a process, it's a journey. And when you have decided that it's a journey of life that you're going to live together, then this is a small chapter. This will come and this will go. Whether it's the outcome is a baby, the outcome is not a baby, whatever it is, but it is a chapter, not your entire life. तो इसको अपनी पूरी जिंदगी ना बना लें. जो आपके बाकी पहलू हैं जिंदगी के उनको भी कंटिन्यू करिए. सो इफ बिफोर यू केम टू मी और सीमा मैम और अनुराधा मैम एंड बिफोर दैट अगर आपके एक लाइफ में था कि आप काम पे जाते थे, काम पे जाने के बाद हफ्ते में 2 बार आउटिंग पे जाते थे या मूवी पे जाते थे या कुछ खाने बाहर जाते थे या दोस्तों के साथ घूमते थे, वो चीजें कंटिन्यू करिए. अपनी हॉबीज मेंटेन करिए, बिकॉज स्पेशली एज यू गो इनटू एडवांस्ड फर्टिलिटी and there are times when we'll advise you that okay, you need to rest for so many days, or there'll be certain restrictions that you'll have to put in your life for some time. You'll have to give up if you're somebody who goes out partying. You cannot drink, you cannot smoke for that entire journey. So this, you have to distract your mind and make it stable इन द गिवन कंडीशंस. तो आपको बुक पढ़ना पसंद है, आपको म्यूजिक सुनना पसंद है, जो भी आपका राइटिंग पसंद है, एक कुछ हॉबी लीजिए जो आपको डिस्ट्रैक्ट करता है इस स्ट्रेसफुल कंडीशन से भी. क्योंकि अब आपने इसको एक अपना लाइफ मिशन बना लिया है, तो जैसे एग्जाम में पास होने में एग्जाम के बारे में सोच के तो वो टेंशन ही देगा. तो यू हैव टू डिस्ट्रैक्ट योर सेल्फ जब आप ब्रेक लेते हो पढ़ाई से. उसी तरह अब अपनी फर्टिलिटी जर्नी से जब आप ब्रेक ले रहे हो, दिन में 1 घंटा 2 घंटा उसके बारे में नहीं सोचना चाहते हो, सो कल्टिवेट अ हॉबी. प्रेफरेबली ट्राई टू कल्टिवेट अ हॉबी जिसमें आप दोनों साथ में हो, so that the bonding continues and your partnership continues. And thirdly, always know science is advancing every day, things are changing every day. तो अगर अभी तक आपको सक्सेस नहीं मिला है, हताश मत होइए. The journey will go on till the time you are continuing with it. We are growing as physicians, we are growing as scientific approaches every day. बी इन द जर्नी, बी इन्वॉल्व इन इट, बी ओरिएंटेड इन इट, बट उसको अपनी जिंदगी ना बनाए. जिंदगी की बाकी पहलुओं को भी साथ में कंटिन्यू करें. लेट इट गो लाइक अ पैरेलल जर्नी. एंड आई थिंक यू विल नॉट लूज होप, यू विल नॉट गेट फ्रस्ट्रेटेड. गुस्सा नहीं आएगा. नहीं तो आई थिंक मैम विल ऑल अग्री, पेशेंट आके तो हमारे ऊपर ही गुस्सा करता है, कुछ हो नहीं रहा है, हम क्या कर रहे हैं. दे गो डॉक्टर शॉपिंग, डॉक्टर बदलने के बारे में सोचेंगे. उससे अच्छा थोड़ा सा इफ यू काम योर सेल्फ डाउन एंड इफ यू टेक वन स्टेप एट अ टाइम, बेबी स्टेप्स जिसको हम बोलते हैं, the journey will be pleasurable. You will not only look at the outcome कि बच्चा हो जाएगा तो मैं खुश हो जाऊंगा या हो जाऊंगी. वो जर्नी भी आपको एक बहुत अच्छी जर्नी लगेगी कि यार हम इसको तो बाद में देख के we'll smile about it कि we went through this together. So when the word together, हम हमारे साथ ही हुआ, तुम्हारे साथ या मेरे साथ नहीं हुआ, या हमारे साथ हुआ, the journey will be very beautiful and it will not look like a task, it will look like a beautiful journey.
Yeah, a couple of points, Tanushri, Dr.
Right.
Tanu, I want to
Right.
focus on, because I am in Bangalore. It's a metro city, and I'm in the IT area. So the first thing, the first time if the couple comes with their parents-in-law or parents, first thing they will ask me, should my wife take a break or leave her job? They are like software engineers. So that is the first thing. Sabse pehle, they will try the girl should quit the job, and then everything will become fine. So my answer to that is, I tell them, please don't let her quit the job. I want to talk to her. So then I talk to her and I ask her whether she's stressed by work. And majority of them will say, doctor, this is our passion, this is what, like engineering karke, software developers or networking, whatever they are in, some are in finance, they say, doctor, we love our work and we don't want to quit. They are just, we are having this pressure from the family, if I quit I'll get pregnant. So I tell them, see, if you're not stressed by work, then there's no point leaving this job for which you have, otherwise, whole day, whole night, a working woman, you put her in the house, she will become more frustrated and more stressed, is what I feel. So one is, yeah, one is that. Second, as you said, they blame each other. Now you also, what I do is, first I talk to the couple, then I bring the parents in law, then I talk to the husband separately and wife separately. This is very important for us as doctors, to give that extra 10-15 minutes to that patient in the first visit, to understand what is really going on in their minds. Second thing, I have seen my patients parents-in-law, supposing the husband comes azoospermic or low counts, and they are like, the daughter's side, they are girl side people, they are celebrating कि girl is normal और लड़के में खराबी है. They just celebrate it. And if the girl we get low AMH or something, the boys, the mother-in-law will come, see, I knew, we should have thought about it, all that. So this is not correct. As you said, they have to go together. So this blame game, I always tell this one word: please, if you are with me in my clinic, stop this blame game. We should not blame each other. We are a unit and we have to go together. So these are 2 points which I wanted to tell. Dr. Seema.
Here now I'll ask some scientific based question, as many doctors are watching this show as well. So Tanu, and when it comes to having physical relationship, and this couple who is going through this journey, his their mind is set, like जब डॉक्टर बोलेगा तभी साथ रहना है. Can you just throw some light on this fertility window and sex around that period,
Right.
and how is it harmful or effective for a couple who's undergoing fertility treatment?
Right, right. Thank you so much, ma'am. It's a very pertinent question. Also, because I think we'll all agree that sometimes patients come to us after they've also seen their family doctor. So they've necessarily not come to a gynecologist or a fertility specialist straight. They've probably gone to their family doctor, या जो भी whoever they've been comfortable with. Sometimes they've been pressurized so much कि in a say a 30-day cycle में they've calculated कि ovulation will be roughly around 14th or 15th day. उनको लिटरली रोज देव बिन आस्क्ड टू मेक रिलेशन 11 डे पे भी करो 12 पे भी करो 13 पे भी करो 14 पे भी करो 15 पे भी करो वन साइकिल एंड दे आर टायर्ड दे आर लाइक नो वी कैन नॉट आई मीन हमसे तो बच्चा होएगा ही नहीं है बहुत ही बड़ा टास्क है ये हो नहीं सकता है. So I think as consultants and fertility specialists, we have to also realize when we are, especially in the initial few months in a young couple, when we are giving them the scope of natural cycles, where we are telling them to keep timed intercourse, we explain it to them कि हाँ ये ovulation window है तुम्हारा, these look like the fertile period तुम्हारा, इस time पे mostly तुमको ovulation होएगा. If they are coming in for a folliculometry, great, because that makes it simpler for us to tell them when exactly to keep a relationship. बट ऑल्सो टू टेल देम कि तुमको अगर सपोजिंग डे 11 डे 13 डे 15 डे 17 पे बोला है, एक हाथ दिन मिस हो भी गया, डोंट पैनिक, डोंट स्टार्ट फाइटिंग कि तुम लेट आए काम से इसलिए ये रिलेशन नहीं रखा, तो मैं रात के बदले सुबह हुआ कोई फर्क नहीं पड़ेगा, इट्स ओके. आई मीन वी हैव टू एक्सप्लेन टू देम कि sperm is alive in the human body, so in the female body for so many hours, this is the window. बिकॉज वॉट हैपन्स इज कई बार द पेशेंट विल कॉल यू फ्रेंटिकली, मैम रात को तो हो ही नहीं पाया, अभी सुबह के 8 बज रहे, अब हम क्या करें, हमारा पूरा साइकिल वेस्ट हो गया. दिस हैपेंस, आई मीन इट हैपेंस सो मेनी टाइम्स. वो कल रात को मेरा हस्बैंड 11 बजे आया, उसने बोला मैं सो गया, अभी मैं 7 बज रहा है सुबह का, मैं क्या करूँ. So I think if we spend just 5 minutes extra to explain it to them that this is a rough window period that we give, so that the probability maximizes. But अगर सुबह का शाम हो गया, एक आध दिन मिस हो गया, it is okay. And this is a very preliminary stage, and we can work around it. Even with IUI cycles, sometimes they panic so much. Oh my God, सैंपल नहीं दे पा रहा है पेशेंट क्योंकि नहीं परफॉर्म कर पा रहा है. एंड इट्स ओके टू लेट द पेशेंट बी फॉर 1 आवर 2 आवर, ठीक है आप रिलैक्स हो जाओ, आप वापस आओ, आपको घर से वापस आना है, 2 घंटे बाद ट्राई करना है. दीज आर सर्टन थिंग्स दैट वी स्पेशली इनिशियली हैव टू बी वेरी फ्लेक्सिबल अबाउट. नहीं तो वो इतना फेड अप हो जाता है, स्पेशली द मेल पार्टनर, कि वो आपके पास आएगा ही नहीं दोबारा, एंड द फर्टिलिटी जर्नी विद यू विल just stop there. So I think we have to educate them and be a little flexible, especially about the ovulation window.
Yeah, because scientifically, if we say when an egg is released, ovulation occurs, at least 24 hours that egg survives. And even if you have intercourse on alternate day, it is okay. See, there always have been school of thoughts about when and how to have, I mean, when to have intercourse, not how everyone will know that. But people think that daily you have to perform. No, it is not like that. Even alternate day you can have intercourse. So as Dr. Tanu was saying, you should not panic about it. Yeah, Dr. Tanu.
Ma'am, I think yeah, that was one thing that I wanted to really add to, and rest, of course, ma'am, you all would be able to advise even better.
Arshi, what
It
is
is
your take on like what? How do you tell your patients? Like a few patients of mine and husband comes and tells, "Ma'am, you have told us to be together, and my wife she doesn't agree. She just let me stay with her for like once a day or how many." Is enough. So as I understand from all these discussion we were having, that it's not important that you have to have a physical relation multiple times a day, and as our experts told that it could be even 1 or 2 days ka gap also. What is
Correct.
your experience? How do you counsel your patients about this whole thing of staying together towards the ovulation window? Like one patient of mine, they were to undergo IUI and they were not staying together for last 13 or 14 days. Reason because they had to undergo IUI. So how do you tackle this?
basically on my first visit, I tried to counsel them that they should be friends more than husband wife. They should understand each other, because harmony is more important, and love and nurture is really very important. I ask husband to pamper the wife, and I ask wife also to pamper the husband, so that at least they can have soft talks. Then as the time come, I always advise them, whenever you feel like, most of the time the husband is tired from work or something or the other, the wife allegate that he comes and he's so tired he sleeps off. So it is never advisable that when the it is in night only you need to have sex. You can have it early morning when the husband is not tired, and it is not required always that you should have it daily. So I always tell them that your sperm will be alive in female track. It is more happy and more survival is there. So don't bother about the timing. It will be there. It is only we need to have repeated after 1 day or 2 day. It can survive, but the probability of conception will increase if you have it alternate day or in a 2 day. But it should not be mechanical. It should be have some emotional aspects, because in pressure most of the males are unable to fulfill the wishes, and the wife is saying I'm not satisfied, I'm not this. So it is always the love factor should be there, and they can have it at least in 2 days or 3 days, or they can go out on the vacation on those days, and they can come after that to the doctor. Sometimes it is so pressurable for them that they don't want to come to doctor. Madam, when you do follicular, we get stressed, so what to do? So I always tell them, in this case you cannot, don't come to me, go out, have a weekend, enjoy for 2 days 3 days, and then when you'll come we'll do a scan whether it is ruptured or not. But give a quality time to your wife, don't be in
Dr.
stress.
Tanu, yeah, thank you, Arshi. Dr. Tanu, I want to ask you one common question which people come
Right.
with us to the
Right.
doctor. Yeah, is vaginal dryness. When you tell them timed intercourse, that is follicular monitoring, that you were that the wife says that it's very painful, the intercourse, and she has vaginal dryness. So, how to tackle that vaginal dryness during
Right.
intercourse?
Right. So, ma'am, two things which I would like to highlight. Number one is what I counsel the couples who come to me also, the importance of foreplay before the actual act of intercourse. Because I think we all forget to mention it because sometimes we are in a rush. Sometimes the couple is not comfortable to talk to us about it. Kabhi elders are sitting, but they have to understand foreplay is very important.
So this is the most important thing, because females are saying कि है ना हमको तो कोई pleasure आता ही नहीं है, it is monotonous, mechanical. So it is always advisable for doctors even to advise them that the husband has to have foreplay for as long as the female is aroused or she's happy. What do you say,
And that will tackle the vaginal
and
dryness to
that tackles the
certain
vaginal
extent.
dryness,
Yeah.
and even the relationship, when the female start understanding and having orgasm and so many things, then she her attitude towards the husband also change.
Now, one more point I want to stress: our people should understand that not to use lubricants like the gels what are available during this time. If for vaginal dryness, they go to a chemist and they give a gel. Now, these vaginal gels, any vaginal gel, if you use for lubrication during intercourse, it will cause the sperm. It is spermicidal, means it will kill the sperms. So, if you are trying for a child, you avoid using these gels. Yes, Dr. Tanushri.
Yes,
Yeah, sorry, ma'am. Yeah.
I wanted to ask Tanu, and I'll just add one top point. If that dryness doesn't go, you can use simple coconut oil or Vaseline plain, but don't go for spermicidal gel, as Dr. Anuradha said. Dr. Tanu, next question, which you must also have experience as all of us, that there are two things. First thing, both of them, they'll tell together that whatever is there, when after intercourse the whole semen comes out,
Comes up.
and that's the
Yes.
reason why we don't get pregnant, madam. First thing,
Right.
so let's tackle this, then I have one more question, then I'll go to that.
Right. So, ma'am, I'll just explain it with the help of this model for the laymen who are watching our show right now. When you
Yes.
keep relations, this is where your the male organ goes in, and this is where you ejaculate. At the beginning of the uterus, the opening of the uterus, which we refer to as the cervix, this goes, and ये जो volume है, this is around 0.4 ml. Is मतलब आधे ml जितना उसका volume होता है. An average ejaculate, a male ejaculate will have anywhere 1.5 to 2.5, 3 ml तक भी. सो इट इज एब्सोल्युटली नॉर्मल. आप किसी भी पोजीशन में रिलेशनशिप मेंटेन करेंगे, सम ऑफ द सीमेन विल फ्लो आउट, एंड दैट इज एब्सोल्युटली नॉर्मल. तो बहुत सारे लोग कहते हैं 30 मिनट के लिए हमने पैर ऊपर किए, हम वॉशरूम नहीं गए 1 घंटे के लिए, हमने हमारा यूरिन रोक के रखा क्योंकि हमको लगा अगर हम यूरिन पास करेंगे तो हम प्रेग्नेंट नहीं होंगे. आपको वो सब थोड़ा बहुत ट्राई करना है कि आपने कहीं पढ़ा है ये पिलो रख के करेंगे तो पोजीशन से बेटर होगा. ऑल दोज थिंग्स यू कैन ऐड, बट सीमेन विल फ्लो आउट, एंड दैट इज नो. आपके यूट्रस में, आपके वजाइना में कोई प्रॉब्लम नहीं है, आपके हस्बैंड भी नॉर्मली परफॉर्म कर रहे हैं. इट्स द नॉर्मल फीमेल एनाटमी जिसमें जो एक्स्ट्रा फ्लूइड है वो बाहर निकलेगा. सो वी हैव टू बी नॉर्मल अबाउट इट, एंड उसमें कुछ आपके एक्ट में कुछ गड़बड़ी नहीं है.
Exactly. And
See,
second,
one, uh, yeah,
yeah. Anu, just one more question I
yeah,
have.
Dr. Seema.
So, yeah. So, yes, and we also have to understand that pinpoint, or the same model I use for mine. So, I tell them that the whole space is a blind space. So, and this is lot of volume which has to come out. Only sperm is to go inside. Second question, they will come up with, ma'am, he comes very fast, the that erection doesn't last, and that's the reason we are not conceiving. So what do you have to tell?
So I think iske do, we can divide it into two aspects. One, that they have to be sure that penetration is happening. If there is an erectile dysfunction wherein penetration ही नहीं हो पा रहा है, you're just at the outside, you're not even entering the vaginal canal, then it's a problem, yes, because the semen will never reach where it's supposed to reach. However, penetration हो गया एक बार और उसके 10 सेकंड बाद भी अगर ejaculation हो गया है, so it will lead to where it has to. I mean, the pregnancy outcome will happen. If the pleasure is a problem, that we can, of course, work it as sex therapy. That is a completely different, outlook that we are looking at. As far as pregnancy is contained, एक बार अगर penetration हो गया है proper और फिर ejaculation हो रहा है कितने भी short period में, there's nothing to worry.
बेसिकली बहुत सारे लोग ये सोचते हैं कि जो सेक्सुअल एक्ट है दैट शुड गो फॉर समथिंग 10 to 15 मिनट्स. वो पॉन देख देख के उसको समझते हैं. जो लोग इतने एजुकेटेड नहीं है, दे थिंक दैट इज द राइट थिंग. व्हाट इज फैब्रिकेटेड, जो भी बना हुआ है, एंड दे थिंक कि मेरे को तो सिर्फ मैडम 5 मिनट 7 मिनट्स इज द मैक्सिमम टाइम एंड इज ऑफ. So they have a wrong notion that the good sex goes for 15 minutes, 20 minutes. So that you need to break the myth that a good sex can be of 3 minutes to 7 minutes.
That 15 minutes include that foreplay, bonding, and everything together. And third thing, it is most of the time stress related and performance pressure which this couple is facing, and it is at subconscious level that he has to be the best. Today morning, the guy I am talking about, third very important top point which they are just keeping inside, that is, ma'am, I have very bad habit of masturbating since childhood, and that is taking a toll. Or sometimes they connect it to the religious beliefs, that god is making them suffer because he was doing something wrong. So please tell us about what is the role of masturbation in some a male's life, and how it's not a bad thing for their sexual future sexual health once they become sexually active.
I'll take this question, ma'am.
Yes.
Yeah. So,
Hi, Raj.
whether it's male or whether it's female, I'm talking to both the audience. Masturbation is not a taboo. Masturbation is not a sin. Masturbation is not something that is wrong. Because ये हमको बचपन से बोला जाता था गंदी चीज हमेशा गंदी जगह हाथ मत लगाओ. These are the things that were very commonly used. Dirty है वो dirty है. So that's why we think of whether touching yourself or the act of sex is dirty, but it is not. As long as it's done with consent and communication, there is nothing dirty in it, whether you're doing it yourself or you're doing it with your partner. Especially when it comes to, like madam rightly said, performance anxiety. आप अपने partner के साथ perform नहीं कर पा रहे हो. And I'm talking about females also, where dryness is so much कि something known as vaginismus होने लगता है. आपकी muscles इतनी tense हो जाती है कि आप penetration नहीं allow कर पाते. दोनों मेल और फीमेल के लिए मैं बोलूंगी इसका सिंपलेस्ट एंड द बेस्ट सोल्यूशन इज व्हेन यू सेल्फ एक्सप्लोर. एंड सेल्फ एक्सप्लोर इज नथिंग बट मास्टरबेशन. आपको जब तक नहीं पता है आपको किस चीज से प्लेजर मिलता है या आप किस चीज से रिलैक्स्ड फील करते हो, तो आप अपने पार्टनर को वो चीज कैसे कम्युनिकेट करोगे. देन मुझे ये पसंद आता है, मुझे ये नहीं पसंद आता है. फोरप्ले इज टू मेक ईच अदर फील कंपैटिबल, लव्ड एंड comfortable in each other's environment. For that, you have to know कि आप किस चीज में comfortable हो. For somebody, something might work. कितनी बार ऐसे होता है that the male partner is saying हम नहीं perform कर पा रहे. Then they go in for masturbation. They realize कि हम जब when we are on top we cannot perform, but when we are lying down we get an erection. So these are very small things yet very important things which मोस्टली पीपल टेंड टू स्किप, क्योंकि इतना टैबू है. ये तो गंदी बात है. हम डॉक्टर को जाके बोलेंगे तो डॉक्टर हमको जज करेगा. डॉक्टर आपको जज नहीं करेगा. इनफैक्ट to all my patients who are suffering from vaginismus, ED, performance anxiety, I always tell them कि तुमको पहले कुछ time you have to indulge in self pleasure, and there's nothing wrong in that. Once you know तुम्हें क्या पसंद आ रहा है और तुम्हारा क्या stress factor है, you can communicate it to your partner. So masturbation is not wrong whether male or female.
Yeah, and that is probably the basis for our for vaginismus, whatever therapies we have, say graded way may what we do. So first, obviously self exploration. Second, whatever dilatation we do, it's also graded. But first, I always ask the lady to put at least one finger there and see. They, half of the time, some of the ladies have this concept that there's nothing, there is no space inside. So for them we are saying that vagina is an elastic tube. It can, it expands so much that a one big 3.5 kg baby comes out of it. So it's not that it will be only in certain cases, Mullerian agencies and all, there we can have blind, short vagina, blind vagina, whatever. But otherwise, overall, the ladies have to understand first that it is an elastic space, expandable, and you just have to relax. Dr. Seema.
Yeah, thank you, Tanu and Anu. Tanu and Anu. What a rhyme. So, welcome, Raj. Dr. Tanu, here is our fourth friend, Dr. Raj Lakshmi Valavalkar. She's from Thane.
Very
Sorry, I got
fun.
caught up. I got caught in traffic. I couldn't get home early enough to join in
So,
on
we
time.
are
Really
called
sorry.
V4, fine. And you are the
Yes.
fifth wheel today, and very important one. So, one more point I wanted to make about this masturbation, when it becomes a habit an addiction, that you start associating it with your stress, your condition, just like smoking, drinking, then it becomes bad. Otherwise, it is a physiological thing, especially in non active sexual males. This is the way to release all those secretions to keep your sperms healthy and alive with reduced load of reactive oxygen species. Fine. So here I would like to take Dr. Raj Lakshmi's view as she has joined us late. Raj, we are talking about couples compatibility in a journey of fertility. And most of the time, we have realized that while going through this painful phase, call it, of getting a child, they lose the perspective of being cordial, loving, and that spark goes off somewhere and they are just drifting apart. What is your view, and what do you want to tell the viewers about how to take control of this so that it doesn't happen to them as a couple?
Yeah, I think two, 3 points basically. I think, um, uh, so sex is a part of a relationship, and it is a very important part of, getting to know each other, knowing each other. And it basically starts with communication. So, if you are able to communicate with each other, if you are able to talk with each other, if either partner is facing a problem, being able to first accept it to yourself and then discussing that with your partner, and the partner who is not sort of who is having the problem, the other partner should not be judgmental. So it's like that part of counseling comes in, because when judgment comes, putting blame starts coming in. So these two things have to be very, very seriously avoided. And sexual incompatibility does exist. Some people have a higher sex drive, some people have a lower sex drive. People have got different approaches towards sex. Some people would not mind being touched, some people would mind being touched. Some people are comfortable with oral sex, some people are not comfortable with oral sex. So, I think it is very important that we as a society become a little more vocal about it. Because very traditionally, Indian households, sex is a word which is never used, and our kids grow up with this thought process that even talking about sex is taboo. So how am I going to be discussing that with my partner? So I think, as far as, and we come from the land of the Kama Sutra. We taught the whole damn world what sex is all about. And if we are going to regress and go back and not, accept, that very important part of life, then obviously the problems are going to come. So, there is, on this one side, there is a social situation where सबका डिमांड चल रहा है, बच्चा चाहिए, बच्चा नेचुरली भी चाहिए, नेचुरल के लिए सेक्स होना जरूरी है, उसके लिए टाइम बनाना जरूरी है, उसके लिए पार्टनर के साथ इक्वेशन जरूरी है और कम्युनिकेशन जरूरी है. तो ये पूरे चक्र को कहीं ना कहीं तोड़ना जरूरी है. So you might initially, so some people might find it easier by making time for each other. Some people might find it easier by addressing the problem together. But what I would like to say to the couples is that जो भी करना है, you have to do it together. ये अकेले में नहीं sort करना है. So Tanu was very, very nicely making a point about, if you are scared about sex or if you find it dirty, at least try and explore yourself. वो exploration में ना, once the person gets comfortable with exploration, with like himself or herself, maybe get your partner to explore that with you, and that will increase the intimacy. So Tanu gave the first step. I think the second step is going to be to get your partner to explore it with you. This is for people who can't do it at all. People जिनकी incompatibility है, literally बैठ के बात करो, बाबा मुझे ये पसंद है, मुझे ये पसंद है. What is the via media? इसके बीच में कुछ हो सकता है which, like both of them are comfortable with. So it is a lot about
So
communication from my
here
point of
is
view.
a point. Here is a point. This was like a word to introduce to the viewers. Apart from emotional and intellectual compatibility, here we are talking about sexual and physical compatibility, and then comes, like, as we were discussing in the beginning of our show, that we are scared of being judged, be the wife or husband. A wife in our society, if she starts telling frankly, forget about certain sect of people who can do it, rest of majority of people, if a girl starts demonstrating or telling that she wants this, she wants that, you know what, she can be like labeled or blamed that she is very smart, she has had previous experiences, even with those stretch marks. I remember in the beginning when I started my practice, and that was first exposure to a rural area, and mother-in-law used to come and ask me, ma'am, उसके पेट पे निशान है, she has had a child earlier and she might have done something, and that's why she is suffering today. So we have to come from out of that mindset. Today I was telling this patient कि हमारे पेरेंट्स, ग्रैंड पेरेंट्स, नॉट पेरेंट्स, ग्रैंड पेरेंट्स और उनके पहले क्या होता था, it was a fixed duty to be performed in the darkness of night. All the male members of the society, they used to sleep outside, especially in villages. They were allowed to visit their wives during those fixed hours, that too without in-laws being aware of it, and the whole act was done just to reproduce, and sometimes there was no other way of entertainment, they were using it as for their own entertainment, and that was the reason sub fertility was not that common as it is today. It is one very minuscule part of the problem. So I think this discussion is so interesting that it will keep go on, and our viewers are enjoying too. But we have to end it somewhere. Before I ask for the shots, I would like Anu, if she wants to take it up and add something.
Yeah. So, number one, sex is not a closed room word, it's not a taboo. It's a normal physiological thing. It is a need of a man and woman to have sexual intercourse. Don't associate it with bad, dirty. Second, sex is not only for reproduction, it's very important. Marriage, the pillar of marriage, definitely is mental compatibility, but it is also sexual intercourse plays a part, because you're not blood related to your husband, right? You are there, you brought together, you got married, and sexual intercourse is an important integral part of a healthy married life. These are my two shots. Third, don't hide anything from your doctor if you're going for fertility issues. Discuss your sexual life. Maybe because we are experienced, we are experts in this field, we may give you small fine points and you may get pregnant just by having intercourse. So in the fertility treatment, the infertility world is not about only IVF, IUI. It's about having even a naturally a baby by timed intercourse. So these are my three shots.
Oh, so Anu came with her shots. I would like to tell Dr. Tanu that in the end of the show, we all of us we have three shots to give. So you are to give your three shots first, but Anu ने पहले बता दिया, ठीक है, कोई बात नहीं. Now Tanu, your three shots for our couples who are going this journey. And before that, I would like to tell you, as Anu said, that we are experts. Means we are not only experts as a doctor, we are also leading that family life. We are facing all those challenges in our lives too, so we can connect better.
Yeah. Ma'am, so before my short, since you said about that we are facing this in our life, I got married very early. And I've been married for 10 years, but I'm still young and I'm still deciding when I want to have a child. But here I sit as a fertility specialist. You won't believe it, ma'am, the number of patients that come to me and they're like, "Arey, आप इतने अच्छे डॉक्टर हो तो आपका बच्चा क्यों नहीं है?" And I literally have to give them like a, okay, I've just started my center. I mean, I literally feel like it's an interview that has started. So very rightly you said that we, especially because I think all of us will agree to it. When not only are we doctors, but we are also females, and we've gone through all these phases and going through these phases. So we do sit here not just as specialists, but also as people who are going through the journey with you. So there's no question of being judged. We are a part of it, not sitting anywhere else. And ma'am, my three shots would be, as we, I think the whole motto of today was that enjoy the journey. There was a patient who came to me for a hysterectomy. She's very old, and for some other reason, she'd come for a hysterectomy. In her reproductive life, she'd gone through 17 IVF failures, did not have a child. But the closeness of the couple, the husband and the wife, was beautiful. Like I talk about this patient to all my other patients. So enjoy the journey, because whether it will lead to a child or not, it will definitely lead to very beautiful dimensions as you as a partnership. Number two, like Anuradha ma'am has beautifully said, stop the blame game. So whatever it is, whether it's male, female, both, unexplained, don't blame yourself, don't blame your doctor. We are all in the journey, we are trying every day, and we will eventually reach the outcome that we desire as a team. And third, don't lose hope ever, whether it's in simple compatibility. अगर आप ये अभी देख रहे हैं, and for 1 year you've been fighting with your partner, don't think that, oh, now the boat is sailed. I wish we'd heard this talk before. Every day is a new day. This moment is a new start. So start your journey afresh and let it be a beautiful one.
Beautiful shots, Tanu. Thank you so much. Now, since Raj has joined late, so Arshi se pehle, I would like Raj to give her three shots today.
Okay, so the first one, which is very important, is communication. Okay, so having a good marriage, you need to communicate on a few basic things. You need to know your religious beliefs, your social beliefs, your financial beliefs, your spiritual beliefs, your emotional beliefs, and your sexual beliefs. Okay, so it is when you discuss all these points before your marriage, you are less likely to have problems after you get married. And I know our like talk today was like marriage and not sex itself, and therefore that was my first shot कि बात करने बैठो शादी के पहले ही कर लो ताकि बाद में प्रॉब्लम ही ना आए. पता चला इनकम्पैटिबिलिटी पहले ही है तो फिर कोई और ढूंढ सकते हैं जिसके साथ कंपैटिबिलिटी हो. The next point, which is very important, is that um, when you start facing problems, okay, do not try and sweep them under a carpet. First, acknowledge that there is a problem and then start looking at ways in which it can be sorted. That is my second shot. And my third shot is there are beautiful treatments available. Okay, counseling hai, there are sex therapies available. Even when couples are absolutely not able to consummate marriage, we have things like self-insemination that will help a couple get pregnant. So, still allow them to get pregnant naturally. And therefore, talk to your doctor. Anu has stressed that very beautifully. Tanu has also stressed that very beautifully. Talk to your doctor. There are a lot of things that we know, but if you do not discuss with us, we are not going to be able to offer those solutions because we need to know the problem before we can look for a solution. So, those are my three.
Excellent shots, and I hope Dr. Arshi comes up with three newer points as her shots so that our viewers can get benefited lot more.
So for the newlywed couples, most of the time they are unaware about lot of things. So I will always advise them to have a counseling session with your doctor. That is very important. Don't be messed up with yourself. If you have any confusion, any problem regarding any aspect, you should always visit a doctor. You can, it is not for treatment, it is for your talking. You can talk freely with your doctor. You can understand things because they know more. So that is very, very important. Don't mess up between two of you. Secondly, those people who those couples who have good sexual life, have good relationship. So for having good, now go in another way, so for developing good relationship, it is always advisable have good sex. Give, devote time to your sex. Don't make it a machinery sort of thing. It will inculcate lot of things, lot of happiness in your family. It is not for babies only, it is for every moment of your life. And thirdly, have one hobby for yourself. It is not only husband and wife. It is like you should have your own me time where you can talk to yourself, you can do what you like. It is not only, few people say I'm a housewife. Forget you are a housewife. You have not married a house and the people over there. It is you also who is there. So devote time for yourself. That will keep your mental health good, and that will inculcate good relationship between husband and wife, and you will be happy. And the day you will be happy, everything will go on by itself. You can have babies, everything will be on top of the world. So the thing is, live for yourself first. Thank you.
एक्सलेंट। यहाँ पे मैं अपने हिंदी दर्शकों के लिए बता दूं, हमारे ये जो 3 ब्यूटीफुल चेहरे हैं, इन्होंने बहुत सारी बातें बताई। और उसमें डॉक्टर अर्शी ने जो कहा कि पहले हमें बेस्ट फ्रेंड होना चाहिए, नहीं यार, शादी होते ही बेस्ट फ्रेंड मत बन
टाइम
जाना,
दो
वो
ना
तो 2
एक
साल
दूसरे
बाद
को
बन ही
जानने
जाओ।
के लिए।
दैट स्पार्क शुड बी देयर। लेकिन मुझे एक गजल की लाइनें बार-बार याद आ रही हैं, बात निकलेगी तो फिर दूर तलक जाएगी। तो दोस्तों, अपने पार्टनर के साथ बातें करिए तो बातों से बातें निकलेंगी, और उन बातों में बहुत सारी सलाहें निकलेंगी, और जिससे आपकी ये लाइफ और खुशगवार और खुशनुमा बन जाएगी। और उसके साथ साथ आप जो कुछ भी कर रहे हैं, वो जैसा डॉक्टर अर्शी ने कहा, अपने लिए करिए। वो मी टाइम, आपका पार्टनर जब तक आपके अंदर, आई एम टॉकिंग अबाउट एक्स वाई एंड टेस्टोस्टेरोन, जब तक आपके अंदर कुछ मिस्टीरियस रहता है, दे आर ऑलवेज आफ्टर यू। सो डोंट stop shocking them, either with your beauty, either with your dresses, either with your mind blowing habits or that growth. Don't stop growing into this relationship. कुछ ना कुछ नया करते रहिए। अगर आपको एक साथ रहने का समय ऐसे नहीं मिलता है, वीकेंड पे वो कैंडल डिनर प्लान करिए ना, उससे बहुत कुछ बदलेगा। और आप टाइम निकाल के, अगर आज के इस बिजी जमाने में वो 2 घंटे चुराते हैं सबसे, और उसमें आप सब कुछ भूल के सिर्फ अपने बारे में सोचते हैं, अपने उस प्लेजर और उस लाइफ के बारे में सोचते हैं, तो शायद हो सकता है कि आपको हमारी जरूरत ही ना पड़े। और ये बहुत ही जरूरी है कि गृहस्थ जीवन का मतलब सिर्फ बच्चा पैदा करना नहीं होता है, किसी भी तरह से पैदा करना नहीं होता है, और हर समस्या का समाधान बच्चा पैदा करना नहीं होता है। अगर हस्बैंड वाइफ की कंपैटिबिलिटी बच्चा पैदा होने के पहले नहीं बनी है, तो बाद में बनने के चांसेस बहुत कम है, क्योंकि बीवी तो व्यस्त हो जाएगी भाई बच्चे को देखने में। तो आपको ध्यान रखना है, फर्टिलिटी विंडो को फॉलो करना ब्लाइंडली जरूरी नहीं है, अपने आप को देखना है। एक मोटा मोटा आइडिया रखिए कि इस बीच में आपको 1-2 दिन के गैप पे जरूर साथ रहना है। प्रीवियस आपके जो एक्सपीरियंसेस थे, वो चाहे मैस्टरबेशन हो, चाहे आपको रात में सेल्फ इजैकुलेशन हो रहा हो, या आपको ऐसा लगता है कि आप परफॉर्म नहीं कर पा रहे हैं, यू हैव सम इरेक्शन और इजैकुलेशन इश्यूज, बिलीव मी, अधिकतर वो जो होता है वो स्ट्रेस की वजह से होता है। और इन सब से अगर बात ना बने, तो इन सुंदर चेहरों से मिलते रहिए, इनसे अपनी बातें शेयर करते रहिए, और आपकी सारी समस्याएं दूर हो जाएंगी। आज के लिए इतना ही, फिर मिलेंगे कल एक नए टॉपिक के साथ, एक नए स्मार्ट और लर्नेड डॉक्टर एक्सपर्ट के साथ। तब तक के लिए मैं डॉक्टर तनुश्री पांडे, एक्स मिसेस ग्लैडरेक्स इंडिया, मैंने आप लोगों को पहले नहीं बताया था, देखिए एक डॉक्टर क्या क्या कर सकता है। और आप इसको इंस्टाग्राम पे फॉलो करिए, आपको इतने वीडियोस मिल जाएंगे आपकी हर प्रॉब्लम के लिए, और इतने अच्छे से मिलेंगे कि आप सोच नहीं सकते हैं। उसके साथ हमारी डॉक्टर अनुराधा खार, डॉक्टर अर्शी इकबाल एंड डॉक्टर राजलक्ष्मी वाला वलकर, V4 की तरफ से आप सबको शबा खैर, गुड नाइट। प्लीज टेक वेरी गुड केयर ऑफ योरसेल्फ, और चाय पकौड़े बना के पति का इंतजार करना मत भूलिएगा। अगले एपिसोड तक के लिए बाय बाय।
और हम एक लास्ट बात बोलना चाहते हैं, क्योंकि हम उत्तर प्रदेश में पढ़े हैं MBBS KGMC में, हम आपसे एक यूपी भाषा में बोलते हैं, आप अपने पति के साथ बातें करिए, बातचीत खुद हो जाएगी।
क्या बात है।
आज का माहौल शायराना हो गया.
It was such an honor, ma'am. Thank you so much for this opportunity. Thank
Thank
you
you,
all,
Dr.
four of you.
Seema, for this
Thank
Thank you,
you.
Dr.
platform.
Anjali.
Thank you, Dr.
Thank you.
Tanu, for coming. Thank you, Raj. Thank you, Arshi. Tomorrow, till we meet again. Adios. Bye bye.